So one way that we treat spider veins is using surface laser. And so surface laser, again, is using heat to treat the vessel. So once it's treated, then the blood vessel actually gets absorbed by your body as scar tissue, so then you can no longer see it. These spider veins are not involved in the overall blood flow to the leg or coming out of the leg. These are just purely superficial vessels that are not needed and unsightly. So a lot of times patients do opt to have them removed using sclerotherapy for spider veins or surface laser for spider veins. Our practice performs at least 30 to 40 treatments a week for spider veins. With our team of nurses, a nurse practitioner, and myself, we provide comprehensive care so that we can assess and make sure where they're coming from, how is the best way that you're going to get the most satisfying results for these unsightly spider veins. Okay, so if you look really closely here, she has some spider veins here on the shin. A lot of times spider veins come on for genetics reasons. That's the biggest reason why patients get spider veins. The laser works by heating the blood and the blood vessel wall around it, and so it causes it to collapse and shrink right in front of you. And so it'll look a little bit red afterwards, like a little bit of a cat scratch essentially, and then it just disappears and goes away within a few days. Treatments are still about every 6 weeks or so, because sometimes some of these vessels do need retreated. We don't promise that they'll be gone with one treatment, but some of them do go away with one treatment, which is kind of exciting. You can see in the window here, and we've put gel on the skin to help cool it. Sorry. Doing okay? This is definitely a lot more uncomfortable than hair reduction. The goal, or the target if you will, is the blood vessel, and so you can see the blood vessel lies a lot deeper than the hair, so the pulse duration is a lot longer, so you're delivering heat to this area a lot longer. Just after a few minutes or so, you can see just the reddish area that we treated. You don't see any of the vessels, but maybe in about a month or so when she comes back, you might see maybe a couple areas that might need retreated, if any. We can also use an injection sclerotherapy to treat this area if we feel like we need to. So there's multiple ways that you can treat them as well. So if you can comment below if you have any questions regarding sclerotherapy for spider veins as well as laser treatments for spider veins. We would love to answer those questions for you. If you've had the treatment, whether it's been here or elsewhere in the area or even in the world, we'd love to hear your experiences as well as your concerns or questions and try to answer those for you as well.